Hi, welcome to my channel. This is Dr. Erica, Pharmacist-in-Charge here on YouTube platform. Like, sub, and share my main channel, Erica Onigbola Farm D. Please like, share, subscribe, binge watch all of my videos. My main channel has been available since 2011, where you can access topics on disease state management as well as pharmaceutical innovations and treatments for preventative care as well as diagnoses. You can also manage your weight. You can also learn about smoking, tobacco cessation as well. And this particular supplemental channel is Pharmacist in Charge, where I focus on biblical study, biblical inspiration, mental health, nutritional health, delicious food, semi retirement life, women over 40. And I also focus on the most recent headlines as far as pharmaceuticals. So please like, share, and subscribe. This video, I want to focus on, by me being semi-retired, I still want to encourage the um, utilization of benefits of the community pharmacy, the community setting, retail pharmacy, big chain pharmacies like your typical CVS or Walmart or Walgreens, your Publix as well. Those particular pharmacies do want you to, like I say in the title, pick up your prescriptions. When I say pick up your prescriptions, that also means delivery. Delivery services provided by your health insurance or prescription insurance. Also, delivery from the actual pharmacy company that will honor your request for delivery. Also, walk in, talk to the pharmacy at the pharmacy counter after being counseled, pay for your prescriptions, and then you can also receive supplemental care as well as any immunization offerings as well at that particular location. What happens when a prescription is not delivered or not sold is that it must be returned back to the manufacturer's on shelf bottle for the next prescription to be warranted. So, when it's put back to stock, is what we call it in pharmacy, that prescription actually increases the cost of dispensing. It also increases the cost of returning because the time it takes to have that prescription filled and returned also increases the cost. After 14 days, federal law requires that a prescription that is not delivered or sold must be put back to stock in order to have the prescription insurance not charged. When we fill a prescription in a pharmacy, the prescription is charged to the insurance company. Once that happens, there's 14 days to be sold. If not, then we put it back to stock typically, or we call ahead to make sure that the patient is not on their way to pick up the medication before we actually put it back to stock. If it's a special needs medication or a narcotic medication or an ADHD treatment medication, then we will go ahead and make all extra efforts to be in contact with that particular family or patient to have that particular item picked up as soon as possible so that it won't be a hindrance to treatment or it won't be a uh, cost issue once it is over the 14 days. We want to make sure those special medications are sold. I typically go ahead and go a little bit further with antibiotic therapy. If a patient has not picked up an antibiotic within a certain time frame, I choose to call the family or the patient as soon as possible to let them know their antibiotic is ready. And the sooner they take it, the sooner they'll feel better, and the sooner they will actually eradicate whatever infection they're trying to treat with the antibiotic. Besides that, I want to make sure I have a loyal relationship, a loyal customer to professional healthcare relationship with everyone that comes into the pharmacy. It builds trust, it builds reliability, it builds a sense of community, and it allows everyone to be on one accord. Anytime there's a discrepancy that comes up, it can be handled in such a way that is pleasurable or less hostile. So, if you are someone who normally gets your prescription filled, you have a trusted and loyal relationship with your pharmacist or your pharmacy team, always get your prescription filled within 14 days or picked up within 14 days. They can also synchronize your prescriptions so that all of your prescriptions will be taken and filled and dispensed all in one day instead of you having to make several trips back and forth, deliveries back and forth to the home or the pharmacy. That saves you on your time, and it saves the pharmacies their time as well when prescriptions are in a synchronization filling system. Also, besides cost, and also besides the the overall rating, the pharmacy receives a slap on the wrist when prescriptions are returned back to stock. They also receive that credit, which will allow the pharmacy to receive a bad reputation as not being productive or efficient or proficient. So, besides the cost, besides the rating, they are also losing that integrity. I want to suggest for any patient, especially loyal patients, do continue to use your local community pharmacy. There's no alternative, there's no replacement. Artificial intelligence can never take the place of a pharmacy team. Even though they are pushing for the implementation of artificial intelligence, still there's no way that the customer service relationship can be bought out by an AI system. Also, you want to make sure that you're informed about the latest. You want to make sure that you're informed about the latest of infectious diseases, the latest in cost, and also if there's any additional incentives that the pharmacy can offer, as like discounts, vouchers, coupons, etc., that you may be able to utilize. So the pharmacy in the community and retail setting is always available to help you, to comfort you, to be there whenever you need to ask a question or have a clinical evaluation done or have some sort of um, one-on-one counseling about how your medication is benefiting you or how you are maybe experience adverse issues. So do be in the know about what the community pharmacy provides and always support your pharmacy. Thank you for joining me. This is Dr. Erica signing off. I hope to see you on future videos. Like, share, and subscribe. Take care, Dr. Erica. Bye-bye.